Welcome, everyone, to our HIPAA privacy training. Protecting patient privacy and confidentiality. Today, we're going to explore what HIPAA is, why it's important, and what each of us needs to do to comply with it. HIPAA isn't just about legal requirements. It's about protecting our patients' trust.
What is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act. Portability ensures individuals can maintain their health insurance coverage when changing jobs. Accountability strengthens laws against healthcare fraud and abuse. It also sets national standards for handling patient health information, especially in the electronic age. Purpose of HIPAA: HIPAA was created with three main goals: help people keep their insurance when they change jobs, prevent fraud in healthcare, create standard procedures for sharing health data electronically. These standards protect both patients and healthcare providers.
In today's world, emails, digital files, and instant communication make it easier to share medical records, but also easier to misuse them. This is why HIPAA's privacy rules are critical. We must safeguard personal health information against unauthorized access. 3 goals of HIPAA. The law aims to give patients rights over their own health information. Keep protected health information, PHI, secure. Limit how PHI can be used or disclosed. PHI includes any information that can identify a patient and relates to their health, treatment, or payment. This is why HIPAA's privacy rules are critical. We must safeguard personal health information against unauthorized access. How our company meets HIPAA goals. We meet these goals by having clear policies and procedures for privacy and security, training every employee on HIPAA compliance, treating patient trust as our highest priority. Role-based access to PHI. Not everyone needs full access to patient information. Medical directors have broad access for treatment and operations. Nurses see only the records of patients they care for. Support staff have limited access for their duties. This is called the minimum necessary standard. Your role in HIPAA compliance. You are often the first person patients speak to when they have concerns. You must follow our policies exactly, only share information when allowed, and always keep patient details confidential. Role-based access means we only see the smallest amount of patient information needed to do our jobs. HIPAA calls this the minimum necessary standard. Even if we have the technical ability to open a record, that doesn't mean we should. We access information because we need it, not because we're curious. Why it matters. This protects patients' privacy by limiting how many people can view their records. It also reduces the risk of mistakes or accidental sharing. Most importantly, it helps patients trust us, knowing that only the right people have access to their information. Walking through the table. For example, a medical director may have full access to patient data. They need it for treatment decisions, overseeing care, and managing operations. Nurses have access only to the records of the patients they are caring for at that time. That includes medical history, treatment plans, and progress notes, but not unrelated files. Support staff, like scheduling or billing teams, see only what they need for their specific duties. That might be appointment details, billing codes, or demographics, but not the patient's medical details. Key rules to remember. Your access isn't fixed forever. It can change if your role or assignment changes. Curiosity is never a valid reason to open a patient record. If you need information that's outside your role's normal access, you must request proper authorization. And remember, our systems track every record you open. Real-world example. Here's a quick example. A nurse in the pediatric unit cannot open the chart of an adult patient in cardiology unless they are directly involved in that person's care. Even if they know the patient personally, HIPAA rules say access must be based on your current role and duties. Your role in HIPAA compliance. You are often the first person patients speak to when they have concerns. You must follow our policies exactly, only share information when allowed, and always keep patient details confidential. As a patient care provider, you may hear patient concerns. Understand your role in meeting HIPAA guidelines. Follow required procedures to protect patient privacy.
Fax communication policy. When sending PHI by fax, always double-check the number. Use cover sheets with confidentiality notices. Verify the recipient if you're unsure. Key takeaways. HIPAA is about trust, compliance, and protecting patients. Always think before you share any information. If you're ever in doubt, don't disclose.
Privacy and Confidentiality Agreement. By signing this agreement, you acknowledge that you understand the privacy rules and our policies. We'll only access PHI for legitimate job purposes. We'll safeguard PHI and report breaches. We'll maintain confidentiality even after leaving the company. This agreement protects our patients, our company, and you.
The employee must follow all privacy rules and company policies, treat all patient information as confidential, access it when needed, and never share it except when necessary and permitted by policy.
The employee must use reasonable safeguards to prevent accidental disclosure of patient information, support patients who request special access or changes to their health information by notifying the branch privacy lead, report any known confidentiality breaches to their supervisor, and after leaving the company, continue to protect confidential information and return all items that provide access to the provider or its data.
As we wrap up today's training, remember that HIPAA is more than just a set of rules. It's a commitment to protecting our patients' trust. Every piece of patient information we handle represents someone's private life, and it's our duty to treat it with the highest level of care and respect. Compliance isn't just about avoiding penalties. It's about doing the right thing, every time, whether anyone is watching or not. If you're ever unsure about what you can share, the safest answer is, don't share it until you've confirmed it's permitted. Let's all commit to upholding these standards, not just because HIPAA requires it, but because our patients deserve nothing less. Thank you for your attention, your participation, and your dedication to protecting the privacy and dignity of those we serve.